Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have another show that's excellent, and I will get to that topic in a minute. But before I do that, I want to say, remember sharing and caring. And it's about caring about each other. If there's a senior that lives in your building, if there's somebody down the block that you know can't get out of the house, if you can just go to the grocery store for them, or a senior that would love to go to the park because it's summertime out, or a child that you know that the family can't take them to the park and you take them to the park with your children, that's sharing, that's caring. We should all be looking out for each other. Very important in life. And it's very important as far as health is concerned, and it promotes health. Alrighty, so sharing and caring. Well, OBHealthy.com is our website. Go on it. There are a lot of medical tips, medical information that is very valuable. It will allow you to understand your medical problems much better. And we all should be educated healthcare consumers. I'm really serious about that. So OBHYourDoctor.com. Go check it out. You can also check me out on Facebook and Twitter. Obey Your Doctor. Facebook and Twitter. Well, let's talk just for a minute. I just want to do a let's talk segment. Pulmonary function test. What is it? We're talking about lung function tests. And what do? They allow a doctor to understand what the functions of your lungs are. So I like to break it up into two components, tissues and tubes. Tissues and tubes. Tubes meaning that if you have your airways in spasm, that's like asthma. That's your tubes that are affected. So your airways spasm up, you can't breathe, and you hear the wheezing. That's asthma. Tissues meaning that the air goes through your tubes into the tissues, and the tissues have to take in the air. So it's like a balloon. It has to expand and contract and go down and let the air out. If the tubes are collapsing down, that's asthma. Alrighty. If the tissues are scarred and they won't expand, that's like fibrosis. And then there are other things like emphysema. If we do a pulmonary function test or a lung function test, that will allow the doctor to understand whether you have asthma, bronchitis, or emphysema. And then he can administer the appropriate treatment. So, pulmonary function test. Alrighty. I know it's a big word, but we have it now. You have the understanding of what it is. Well, tonight we have an interesting topic, and I think it's a topic that's very, very important because even though it's not at the topic that's a disease entity, it's a topic that's interesting because I'm going to step back for a moment, and I want to have a show where we give you an understanding of what you should ask your doctor. When you go to your doctor, what questions should you ask? How should you ask them? How should he give you the answers? What kind of answers? Should you understand the answers once you leave the office? All of these are very, very important. So we're going to cover these topics today. And I have Dr. Dean Rice, who is here, and he's an internal medicine specialist. And he's going to cover these with us. He's going to get you to understand that you can be comfortable really going to your doctor and talking to them about the problems that you have so that when you leave the office, you really understand what you need to do. Dr. Rice, welcome to our show.
Thank you for having me. It's my pleasure.
All righty. So this is getting you back because we've had you here for other topics, and you did so well, I had to get you back.
Thank you.
All right. But this is an interesting topic, and I wanted to cover this topic because there's so many patients that come to the office, and they really, they're really a little afraid. Mm-hmm. Going to the doctor is not the easiest thing in the world. Number one, we men, you know what, men,
especially,
we don't like going to the doctor. So when I get there, I got a little bit of an attitude anyway because she drugged me in here. You know what I mean. Uh-huh. But what I'm trying to say is that I'd like to just have a discussion as to how someone should feel? Can you be comfortable? Questions you should ask, and how the doctor should respond. Because if he doesn't respond appropriately, then maybe there are things you need to do. You know, either approach him or ask him or her certain things, or maybe find another doctor. And even that's a possibility. So let's start off with this. How do you choose a doctor? Like, if I don't have one, how do I find out where good doctors are?
Well, that begins the entire process, and there's a number of different ways to find a particular doctor that's appropriate for you. Usually the hospitals have a information base that they can refer you to a long list of physicians in whatever specialty you're concerned about. But the word of mouth and knowing which physicians participate in your particular healthcare plan is very, very important to limit the cost of the encounter in overall medical care. So one of the ways that I've noticed that people find me is through interaction through the medical center. I'm at Newark Beth Israel Medical Center at this point, and through their particular insurance companies. They'll give you a list of some names in the area, and one of the things that has to happen when you choose a physician, convenience is important. But I don't think that convenience should be the number one reason why you choose a particular physician.
Right.
You have to have some confidence, and you should have some kind of knowledge about what their practice kind of process is like, and where they're located and what they're going to have to offer you. So one of the best ways is word of mouth. Right. You know someone who has a particular physician, you ask around and see how satisfied they are. And certainly they would need to be participating in your particular insurance, but you want someone that you can communicate with. And you brought that up. I was so happy to hear you explain this pulmonary function test. I have never done it with such accuracy as you've done it, but you need a doctor like yourself who can explain that whole process to you in layman's terms, we say. You try to explain something to an individual in medical terms, and if you don't understand it, it's really a waste of time for you to have them have the test. So you want to find a physician that you can communicate with, and I think the best way, the best referral is word of mouth.
Okay. Do you think there's a possibility, well, put it this way. I know that if you go for a job or if you do something, you get interviewed.
Yeah,
That's
right.
What I mean?
That's right.
Do you think we should interview our doctors?
Well,
in a sense,
yes.
You understand what I'm
Yes,
saying?
I do. Yeah.
Making sure that we can communicate, making sure that you understand what I'm saying.
Exactly.
Our personalities
Yes.
gel, and
Yes.
if you have no bedside manner, then am I going to stay here and deal with this?
One of the ways you can do that is call the office during business hours and speak to the staff. And you ask some questions that are important to you. When the hours are. First you call, and is someone going to answer the phone? That's number one. Are you going to be able to speak to someone? Yeah, I think it's a big deal. And speak to the staff and try to find out what their personality is, because often the personality of the staff mirrors, or is it's similar to the personality of the provider. Now, it's going to be difficult to have a conversation with a physician if you don't have a relationship with them. Right. I'll have to tell you, to interview your physician before you make an appointment to see them, it's a difficult process. But sometimes you may be able to in certain circumstances. If you have a patient, if you are a family member, obviously. That sees them, or a close friend, and you communicate that your close friend has seen this particular physician. I was wondering if he'd be available to take care of myself. You come through like that, but the interview process often is the initial visit.
The initial visit.
And once you have the initial visit, if you're not happy and comfortable, that relationship might not be optimal for you. And no one's locked into one particular individual.
Right.
I don't know, it's probably going to be, one of your questions, but you have to be able to have that communication.
Right.
And if you don't early on, when something happens, when it has some untoward effect happens, or you're going there for relief of some kind of a ailment, when things get tough, you may not get the satisfaction that you want. So Your initial interview, first impressions are very, very important,
Right.
Especially in the doctor-patient relationship. So that can be established early.
I was thinking about something and something you said. You said a family member. If you have a family member that, and if it's a mom or a sister or something, if they don't mind you coming, you would have to ask them,
Right.
is it okay for me to come and sit in or just be part of, even if you don't stay there the whole time, just come in and you don't you may not talk to the doctor even, but just see how he interacts with that family member. If he interacts and talks the way you would want your doctor, then it would be a good fit. And that's a way maybe you could do it as well.
And the staff, because when you have an interaction with your physician, no matter what, if it's a specialist or it's a primary care, first communication is going to be with that staff.
Right.
The individual who answers the phone, that's the most important person in our offices. If you have a relationship or if you feel that they're acting aloof or they're not really communicating with you, that's a good sign that you would need to communicate that with the physician if you have that relationship. Or you might want to look into finding someone that you can communicate with, because that's the most important part of the encounter.
All right. So we've established that I want to see this doctor.
Okay.
And so what do I bring with me the first time I see him?
That gets me every time. I think it's very important, especially now with all the different kinds of insurances and how their requirement and what they propose and provide is so different. You read your insurance information. The book is intimidating and it's full of jargon that you might not, but there is a section in every insurance that says this is what you need to know.
Right.
Your copay, how much you're going to have to pay to see the doctor, what doctors you have to see, what would happen if you don't see a doctor who's in your insurance, what to expect, deductible. I mean, these, do you need a referral if you want to see another doctor? Do you have to see your primary doctor before you see a specialist? These are things that are so instrumental in you having a successful visit. Because if you're going to spend time asking those questions at your visit, it's going to take away from you asking about your back pain.
Right. So let's step back just for a minute, because you hit several words that are very important that I think may have flew over my head. All right, check this out. Deductible. What's a deductible?
So a lot of the insurance companies, especially the ones that are provided through an employer-based insurance with your job provides your insurance, and they'll customize insurance plan based on what they want to give their employees.
Right.
So the deductible is the amount you have to pay over either a calendar year or a 12-month year before they'll start paying.
So wait a minute, if I go see my doctor every 3 months, and my doctor charges me a certain amount, and that deductible, whatever that deductible is, I have to pay out of my pocket until I meet that amount, and then my insurance start paying.
Then your insurance will pay, and it varies from insurance to insurance, from payee or a payer or employer to employer. So and from year to year.
Oh boy.
So each year you're going to get a packet, and they're going to tell you this year you have to pay a certain amount before they'll start paying 90%, 75%, 100%. And a lot of people don't understand that, and it changes dramatically often. And if you don't understand that, you'll ask for some evaluations that may or may not be absolutely essential that you may have to pay for.
Copay. Just explain that real quick.
Okay, so the copay is the price that you'll have to pay for a particular encounter. So some insurances will ask, when you go to your doctor, it's usually less for a primary care than it is for a specialist, and much less than for the emergency room.
Right.
A certain amount that you'll have to pay at the time of the visit, and then the insurance will pay the rest. So they might say your copay is $20, $25, $5, $50, and then the rest, if the doctor charges $75 or $100, the insurance will pay that portion of it. But that's your obligation when you walk in to have a particular encounter.
Okay. All righty. When you see the doctor for the first time, some of the things just tell me some of the things that you expect or that you will do, like take a history. And so if a patient has a hard time speaking, or if a patient, should they bring somebody else along with them, or if is it a good idea to bring somebody along with you to see your physician, especially seniors and patients that have, because you're coming because you're sick, and obviously sometimes when you're sick you don't hear everything because you may be in pain or you may be worrying about your disease or something like that.
Well, and it's important that you do that because they have these laws through the federal government, the Health Insurance Portability and Accountability Act, HIPAA, commonly referred to, that a physician can't talk to another individual about a particular individual's health status without that individual giving consent.
Right.
And the consent has to be given alone between the physician and that individual. So, for instance, a family member comes in, I see the family member, they tell me what's happening, I decide about a care plan, and then they leave, and they have all of this information, and then a family member calls up and said, you know, you saw my relative. What are you going to do? And you know, what's wrong with them? And I'm limited in the amount of information I can give them by law.
By law.
I would love to, even if I establish that they might not understand completely what's happening, but by law, I'm not able to go into details about what's happening. So then now we have to get that patient back either on the phone alone, back into the office alone, so I can say, so-and-so call. Do you want me to tell them what's wrong with you? And if you do you want me to tell everything? Is there something that you don't want me to tell them? Or in other words, I want you to tell me what to tell these individuals.
Right.
And so for that reason, to get back to your question, yes. If you're going to be involved with someone's care in any capacity, please accompany them to the visit. At that point, we can establish during the registration process or the initial interview, I can talk to the person and say, listen, you have someone come with you. Do you want me? I'm not going to ask, is it okay?
Right.
Do you want me to talk to them? Is it okay? Is it your wish that they be in the room during the interview? And then if they say yes, we document it there.
Right.
You can establish a healthcare proxy where I will definitely talk to them as well.
Right.
So
healthcare proxy. Now you throwing this out.
so sorry.
That really went past my ears. What's a healthcare proxy?
So recently, often, a patient comes in and might not have the wherewithal or the ability to understand all of these complicated medical goings on. So you can establish, you can say, okay, I'm probably not going to understand what's happening. My daughter is much more knowledgeable about these kind of things.
Right.
I would like for her to be the one that you speak to in terms of my illness. And if there's any decisions that need to be made that I don't want to make or that I can't make, then I would like her or that particular individual to make those decisions. And that's the proxy.
The proxy.
And you give that ability to that individual. And it's limited. It can be, or it can be overwhelmed. It can be the entire process. So, and you establish that. So that comes at the time of the office visit. So as you mentioned, it's if you're going to be involved with someone's care, it's best to make an appointment at a time where both of you will be available so that you can give some input.
Okay. When I make my appointment, I got all these things in my head that I want to tell you. And as soon as I walk in that door, guess what? Poof, I can't think of one of them. Should I write things down?
Certainly. Yeah. Whatever you need to do to convey what the problem is, I think is good. Because what's going to happen is when you come in there, you're going to get 2 or 3 pages worth of questions that we're going to ask. Social Security number, birth date, all kinds of previous illnesses, next of kin, all kinds of information about medications. We're going to be asking you so many questions. By the time you get down to the encounter, which is going to be a limited amount of time that you'll have with the physician, you're on. Just like when you turned on that light, it said, okay, you're on. You're on, and you have a certain amount of time, between 15 to 30 minutes to get everything by. So if you come in with a list, it's fine. As long as you can communicate what the problem is, I think that's advisable. That's a good idea.
Now, a lot of patients, put it this way, they're intimidated to a certain degree. Let's be fair. And they're a little fearful. And they may be unsure whether they should stop the doctor and say, I don't understand what you meant by that. or the doctor, and there are some doctors that the words are this long, and by the end of the interview, they have no idea. So the patient gets home, and so the family member says, "So what did the doctor say?" I don't know. He said, "Take these pills."
Yeah, had a bunch
You know
of
what I mean?
information. Yeah.
So tell me how you found and how you talk to your patients, or even how you get your patients to relax so that they can ask you these questions or stop you, and you understand what I'm saying.
Well, you have to ask questions.
Right.
When you're there, we have an abundance of knowledge, and it's sometimes difficult for us to communicate with everyday individuals all the things we know about a particular problem. So you have to at least come out of the encounter knowing more than you did before you came.
Right.
And it's frustrating for individuals because it's intimidating to come there and have to sit in front of someone and tell them all of these things.
Right, right.
And this isn't your relative or best friend. This is a stranger usually. So the way you explain that, and I go back to that, the way you explain the pulmonary function test is just it was just wonderful. It was just, and that's what needs to happen when you go to see your physician and he tells you we're going to do a particular test. You know, you say. You tell a patient you're going to do a pulmonary function test, and then they'll say probably okay.
Okay.
And they won't have a clue what
no
actually
clue.
is going to happen.
Right.
So your physician should tell you, listen, we're going to put you in a little booth. We're going to put a tube in. You're going to blow into the tube very, very hard as much as you can. There's no needles. It's painless. We're going to find out about the tubes and the tissues, and we're going to see how your lung is functioning. And that's what you want from your physician. So when when they tell you something's going to happen, say, doctor, explain to me in a way that I can understand it. I think that's the best way to communicate it. Explain it to me so that I can understand it. And if you can't, then we have one of those problems that we talked about.
Yeah, it's like, look in the phone book. Alrighty. Now, do you find that certain patients may come in your office, and if they don't understand something, do they ask for literature, or do they ask for videos maybe, or now the web? Do they ask, is there a website that I can go to and read more about this? Does that come across very often?
Well, one of the ways they can do it is to go on the internet and go to obeyyourdoctor.com.
And look, and you get all the information you want. Right, I got you.
There's information, there's a wealth of information that's available. And often we try to give information on certain things, hepatitis C, hypertension, hyperlipidemia, that kind of thing. So ask for it. Say, I really don't understand. Do you have something that I could look into, that I could look at? And they should be able to furnish you with that. There's just up to date. That's one of the ways to get things. And WebMD, a fund of knowledge in that. So yeah, there are some informational things that help. Yeah.
All righty. Tell when things like treatment, and I want to get into medications. Treatments. How do you should the patient ask what are the benefits of the medication? Will there be any side effects? And things like that. Are those important things that the patient should ask if the doctor's writing prescriptions and here, take this 2 times a day, you'll be fine? Should he get more information than that?
There's a list of side effects for every medication, including vitamins and Tylenol. Everything has a side effect, a adverse effect as well as a beneficial effect. Yes, you should ask, what am I going to expect by taking this? Is this going to make me pass out, dizzy, sweat, nightmares, make my hair fall out? Yes, you should ask that, and they should be able to tell you within reason. Some of these things are happening in less than 1% of people, but some things happen rather often, especially with medication for diabetes, blood pressure, and that kind of stuff. So that is an excellent question to ask.
Right. What about if you get home and you're taking this medication and you're just not feeling right with it? And you're not sure if it's the medication or something else, or what do you do then?
You call immediately, call the next day, if it's that day, and explain exactly what the symptom is, what bothers you, and when it is in relationship to the medication. You don't want to just stop a medication and wait 3 months and go back to see the doctor and when he asks, what happened with the medication? Well, I stopped stop taking it a couple of days after you gave it to him, because he's expecting
Right.
you to be better based on the therapy. So
Right.
you have to keep that communication in.
Right, right. Should you have a daily routine as to how you take your medications and you know what you and you know exactly what to expect that from this medication at the end of the treatment? You know, things like that. Should your doctor actually lay that out for you?
Yeah, you know, and it's important when you get a prescription for a medication or someone gives you something to intervene on a particular problem, to know whether this is going to be taken for weeks, months, years, or is this going to be finished after your prescription runs out?
Right.
Oftentimes we'll see a patient and start them on an antihypertensive medication or blood pressure medication. They'll take it for the 30 days, and when it's run out, they'll stop.
Right.
And they'll come back to the office and they'll say, well, are you still taking it? And then that has to be communicated that this medication is to be taken until you're told not to.
Right.
Unless there's an adverse effect, and then you need to communicate that with.
No news is good news. If the doctor sends you for a test and you go back and he doesn't really go over that test, is that good news?
No. If you've had a test performed, you would want to ask what the results of the test are, definitely.
Okay.
And we have these things, well visits and routine visits, yearly visits, where you'll have some evaluations done, and usually you're sent something in the mail in a timely fashion to let you know that everything was okay. Overwhelmingly and very rarely would you have something done where there's a significant abnormality and not be notified, but it's best just to confirm.
You know, this has gone by so fast.
It has.
I mean, we didn't get
There's so much to talk
so
about.
much
isn't
to
there?
talk about, and we didn't get through one
We'll have to do
third
part
of
two
it.
at some point.
But we have to stop here.
I understand.
All righty.
Yep.
Dr. Rice, thank you for coming in.
Thanks for
thank
having
you
me. It's
very
my
much.
pleasure
We're
again.
going to have to get you back.
I'm right around the corner.
All righty, all righty. So, in closing, remember, sharing and caring. Go ahead. If there's somebody out there that you can help, guess what? Go ahead and do it. Just because you can. Sharing and caring. All righty. Never institute any change in your medical care until you consult your physician. I trust each and every one of you continued good health. Listen, and remember, guys, OBeyYourDoctor.com. Go check it out. It's a website. It has all of the information that you would need to be healthy. Check it out. You'll see what I mean. And you can Facebook me, Obey Your Doctor. Okay? Until next time, I trust each and every one of you continued good health. Hey, peace until I see you again.